Good evening to everyone. Happy Navaratri.
And hello everyone. Welcome to Apollo Fertility session on infertility and stress. We would like to welcome our in-house expert, Dr. Arun Madhav Barua, who is a specialist in obstetrics, gynecology, and infertility. He holds a degree in MD, PhD, a PhD in gynecology, FICOG, and FICMCH. He has more than 35 years of experience in the discipline. We welcome you, sir. We hope today people learn more about stress and infertility and get a more descriptive analysis on how it works and how they are related. So, thank you, sir, for joining us, and you can take over the session now.
Thank you, Smriti. Happy Navaratri to all the viewers, those who have tuned in to enhance your basic knowledge on a subject. I think that's common for every one of you because someone of the other in the family has affected through these common words stress and obviously either infertility or fertility. So the questions are often asked. सभी लोगों को जब भी मिलते हैं हम लोग यही सवाल होते हैं, अरे मेरा इतना स्ट्रेस हो गया, मेरा हो ही नहीं रहा है, मैं 4 साल से कोशिश कर रहा हूँ. So different factors do come in. We'll try to take you around how stress and fertility is related. So I bring greetings from Apollo Fertility in general and Apollo Fertility Guwahati in particular, from where we are going to give this presentation. So fertility is a growing domain now because there is more stress into the lifestyle of every couple. And when you do not achieve your desirement, obviously the stress enhances. What we say, inability to achieve conception despite 1 year of frequent unprotected intercourse is what medically we call as an infertile couple. लेकिन हम लोग इसमें रुकते नहीं हैं. अगर कोई कपल और 1 साल रुकना चाहते हैं तो ऑब्वियसली हम उनको कहेंगे कि आप लोग 2 साल आराम से रुक सकते हैं, प्रोवाइडेड आपकी उम्र सही हो, आपकी कोई दूसरा बीमारी साथ में ना हो, और डेफिनेटली बाय द एंड ऑफ 2 years हम लोग जो देख रहे हैं सोसाइटी में, जिसके पास नॉर्मल कंजुगेट लाइफ चलता है, उन लोगों को 90% सक्सेस 2 साल के अंदर आ ही जाते हैं. तो काफी स्ट्रेस इसलिए होते हैं कि मेरे पास सही नॉलेज नहीं होता है कि कब कोशिश करें, हाउ मच टाइम वी शुड अलाउ फॉर द प्रेगनेंसी टू रियली टेक प्लेस, बिकॉज वी ऑल स्टार्ट डिमांडिंग प्रेगनेंसी थिंकिंग दैट जब भी मुझे चाहिए वो मुझे लेना ही है. तो मैं भी यही देखता हूं कि हाउ मच आई कैन हेल्प यू ऑन दिस, बिकॉज स्ट्रेस एंड इनफर्टिलिटी आर द टू साइड्स ऑफ द सेम कॉइन. एक दूसरे से हमेशा जुड़ा हुआ रहता है और हम हमेशा कोशिश करेंगे कि ये दूसरे को हमेशा साथ ना दे, लेकिन however we try, they are always interrelated. So coming to the stress, ये वर्ड अब दुनिया में ऐसा हो गया है, हर आदमी के साथ हर मोमेंट में ये स्ट्रेस जुड़ा हुआ रहता है. What exactly do you mean by stress? इसका कोई डेफिनेशन है क्या आपके पास? The answer is big no, because there is no existing definition that is being agreed upon across the globe. The reason is, what is stressful for one person may be a pleasurable for having little effect on others. तो देखिए, कोई काम मुझे स्ट्रेस हो रहा, मैं स्ट्रेस फील कर रही हूँ, लेकिन उसी काम से दूसरों को मजा आ रहा है. So it is very difficult to define what exactly the stress is. And एक बात और भी सही है, कि स्ट्रेस में हम लोग हमेशा रिएक्ट अलग अलग से करते हैं. We all react differently depending upon our knowledge, depending upon our nature, and depending upon the environment where that particular factor really comes in. So फिर भी देखते हैं where we can really meet. So stress and fertility is related. Science has proved that they are all related because जब भी हम लोग कोई बातें कहते हैं एज ए साइंटिफिक पर्सन हम लोग इसको प्रूव कर लेते हैं. So how do you prove this? The woman whose saliva had high levels of alpha amylase, an enzyme that marks stress, took 30% longer time to become pregnant than to those who do not have this enzyme. So देखने से किसी को मालूम नहीं भी हो सकता है कि इनके अंदर में स्ट्रेस है या स्ट्रेस नहीं है. So हम लोग जब जांच करते हैं, when we document it, and how do you document stress? That is by doing a biochemical analysis of a particular hormone called alpha amylase from the saliva. अब सवाल है, can stress really impact fertility? The bottom line is infertility certainly causes stress, but stress doesn't certainly cause infertility. A very difficult words to separate from one another. But having said and understood the relationship between the stress and infertility is always debated depending upon your knowledge, depending upon the situation, and also depending upon the demand. जितना हम लोग ज्यादा डिमांड करेंगे उतनी ही हम लोग का स्ट्रेस और बढ़ेगा. सो व्हाट आई से इज इट इज ऑलवेज बेटर टू हैव ए ग्राउंड रियलिटी ऑफ द नॉलेज जिसके ऊपर हमारा स्ट्रेस हो रहा है. तो अब थोड़ा हम लोग देख लेते हैं व्हाट आर द रिक्वायरमेंट्स फॉर कंसेप्शन. आप जो देख रहे हैं आपके स्क्रीन में, इसमें जब भी हम लोग रिलेटेड रहते हैं, इंटीमेट होते हैं, तो around 300 millions of sperms are deposited in a female vagina. अगर स्पर्म सही है तो within 2 to 10 minutes वो जाके फेलोपियन ट्यूब्स पहुंच जाते हैं. But remember, only very few, कहाँ 200 to 300 million, और जो पहुंचता है ओवरी में ओवम के पास, that's only around 300 to 500 in numbers. तो जब पहुंचते हैं, जब फर्टिलाइजेशन हो जाते हैं, the fertilized product that we call it zygote returns back to the womb, and that is how a pregnancy is finally formed and gets implanted in the womb. और वहीं से शुरुआत होता है एक नया जिंदगी का. और बच्चेदानी में वो बच्चे बड़ा होने लगते हैं, वो माहौल सही होना है. So this is what is all about conception. तो हमको एक स्पर्म चाहिए जो सही होना है, जो तुरंत इंटरकोर्स के बाद ओवम तक पहुंचता है. सेकेंडली, हमको एक सही ओवम चाहिए जो औरत के ओवरीज से तैयार होते हैं महीना में एक. और जब भी हम लोग सही वक्त पे या कभी भी हम लोग रिलेशनशिप पे रहते हैं, तो स्पर्म just climbs up by its power and reaches the ovum, fertilizes it, and the fertilized product ultimately returns and reaches the uterus in around 5 to 7 days time. और उसके बाद वो वहीं पे अटक जाते हैं and get its nutrition, oxygen and water, the three basic things for life, from the mother's womb, and ultimately that particular embryo grows continuously to a full-blown human being. So यही स्टेप्स है कंसेप्शन के लिए. इसी को हम लोग फर्टिलिटी में हर पेशेंट जब भी हम लोग के पास आते हैं, इनको समझाने के लिए कोशिश करते हैं. तो यही स्टेप अगर बराबर नहीं बनते हैं, जब भी हम लोग सोचते हैं, then what grows within is stress. So information about conception is the power. क्योंकि कहीं कहीं somewhere down the line we might not be having the right knowledge So we have started demanding pregnancy, asking for pregnancy at will. And when you do not get the answer, when the lady or your better half starts her period, we all get demoralized, टूट जाते हैं, रोते हैं, गुस्सा करते हैं, और कभी कभी सेपरेशन भी शुरुआत हो जाते हैं. So information, right information or accurate information is the power to bring down your stress, because social media today has access to everything in the world. So, from the side of Apollo Fertility, it is our honest and sincere endeavor कि हमारे जितने सारे पेशेंट्स है, जितने सारे वेल विशर्स है, सभी को हम लोग सही जानकारी दें, और उसी जानकारी को लेकर अपने आप बिना कोई ट्रीटमेंट का अगर उनका बच्चे बन जाते हैं, then I think we'll remain very happy. It is not really meant that we are opening a fertility center and we will really offer treatment to everyone those who need it. And with these advices, that real advices, हम देख रहे हैं कि कम से कम 30 to 40% कपल को कंसेप्शन होने के लिए हेल्प करते हैं. एंड दैट इज व्हाई वी आर हियर इन फ्रंट ऑफ यू टुडे. तो अब थोड़ा बातें करते हैं हाउ स्ट्रेस कैन इम्पैक्ट फर्टिलिटी. जैसे मैंने पहले कहा, दीज आर फर्टिलिटी एंड स्ट्रेस आर द टू साइड्स ऑफ द सेम कॉइन. बार बार मैं कहूंगा, हमेशा कहूंगा, बिकॉज दिस इज द रियलिटी. Now, when you have a stress, किसके लिए स्ट्रेस होते हैं? हम सोच लिया मुझे इस महीना में मुझे प्रेग्नेंट होना था, लेकिन मैं प्रेग्नेंट हो नहीं पाया. So when your personal requirement is not attained, we have developed the stress, and thereby we react to that stress by so many different ways. Either हम लोग काफी ज्यादा सोते हैं, or we do not sleep at all. And everyone knows एक जिंदगी आगे निकलने के लिए रेस्ट या स्लीप का कितना इंपॉर्टेंट रोल है. Give into the emotional eating or not allow enough time to eat right. क्योंकि हम लोग सोचते हैं कि मुझे तो होना ही चाहिए था, हम लोग इतने सही हैं, सब कुछ मेरा सोच सही था, फिर भी मैं इस महीना में प्रेग्नेंट नहीं हुआ. चलो जो भी हो देखा जाएगा, आई विल जस्ट लीव एनीथिंग, जो भी मुझे चाहिए मैं करने के लिए तैयार हूं. So the thought process is not always right. So how do you cultivate the thought process? Have the correct knowledge, get the correct information from the right place, and we are trying hard to share our right knowledge to every one of you, so that you become an powerhouse of knowledge, true knowledge. एंड उसी को साथ लेकर के आप लोग हमेशा अगर आगे निकलेंगे, देखिए स्ट्रेस भी नहीं होगा और रिजल्ट अपने आप आना शुरू कर देंगे. सो व्हाट इज द नेक्स्ट पॉइंट? नॉट फाइंडिंग एनफ टाइम फॉर एक्सरसाइज और पुश योरसेल्फ टू एक्सरसाइज टू हार्ड. अब अगर आज के दिन में आप किसी डॉक्टर के पास जाते हैं, और ज्यादा से ज्यादा अगर फर्टिलिटी डॉक्टर के पास आते हैं, तो हमेशा हम लोग एक ही बात कहते हैं, you need to exercise, you need to bring down your weight at least by 3 to 5 kgs. क्योंकि हम लोग आपके बदन पे एक सही हार्मोन लाना चाहते हैं. और प्लीज बी इन्फॉर्म दैट फैट इज creating an abnormal hormonal milieu in the body. So if you are trying to help in that abnormal hormonal milieu, I think your stress, your fertility outcome will further deteriorate. So please find enough time to exercise. और क्या एक्सरसाइज करेंगे वो आपके ऊपर है, क्योंकि exercise today has become a part and parcel of everyone's life. If you are to remain healthy, you need to bring in exercise like other routine of life. खाना पीना, सोना, टॉयलेट जाना, जो हम लोग कभी भी तैयार कर लेते हैं. हम लोग जितना भी बिजी हो, ये अपने काम हर समय निकाल के कर लेते हैं. तो प्लीज ब्रिंग इन सफिशिएंट टाइम टू एक्सरसाइज योरसेल्फ, ताकि आपके बदन पे सही हार्मोन हो और आपकी फर्टिलिटी में काफी हेल्प हो जाए. Today, many of us, I say many of us because I know whenever we are stressed out, एक सोच हम लोग का दिमाग में बन गया, चलो एक पेक ले लेते हैं, क्योंकि we feel that if we drink, the stress really separates us from the reality. But remember, we do not drink alone. We drink along with smoking. We drink along with diet that is not conducive to normal health. तो इसीलिए देख लीजिएगा, जिंदगी आपके ऊपर है, नॉलेज देना मेरा कर्तव्य है, तो वही मैं आपके साथ शेयर कर रहा हूं. डू नॉट गो बाय द बजेट, गेट इनटू द रियलिटी और गेट इनटू द रियल नॉलेज. ड्रिंक टू मच कॉफी, स्पेशली इफ यू आर sleep deprived. Caffeine is not really friendly with fertility. So, keeping yourself awake for a longer duration, जब भी हम लोग आजकल रात भर में दिन भर में काम करते रहते हैं, because we have to perform, we have to give result to our seniors. So that is what is stress. तो उससे अगर हम लोगों को आगे निकलना है, definitely knowledge and knowledge can help us out. So the relationship between stress and infertility is well documented. As I said repeatedly, they are dependent on one another. So what we have to do, the impact of stress on ART outcome is still somewhat controversial. And what do you mean by ART? Assisted reproductive tactic. ये क्या होते हैं? जब भी एक नेचुरल वे में हम लोग को फर्टिलिटी रिजल्ट्स आते नहीं है, जब भी आप लोग हम लोग के पास आते हैं, तो हम लोग काफी सारे जांच करके आपको बताते हैं कि ना आपका ये प्रॉब्लम है, आपकी ये प्रॉब्लम है, तो हम लोग आपको कुछ सलाह देते हैं प्रेगनेंसी सही रास्ते पे आने के लिए. तो दैट इज व्हाट इज नोन एज ART प्रोसीड्यूर्स. तो whenever you undergo those procedures, you are already subjected to a certain amount of stress. So if you want to do away with this, please cultivate meditation. Please bring in exercise to your daily routine. At least do spend and respect your body and do certain yogas so that your pregnancy is achieved on time. And once the pregnancy is achieved, that pregnancy is continued in a healthy manner for the rest of the duration. And that is why we are here to help you all the time. If we look at the male population, the male who are stressed out for their different reasons, they have their sperm function poorly optimized. There is damage, and ultimately the sperm will not be able to fertilize the female egg even though they reach out on time. So bringing down the stress from all point of view is very, very important. Preconception stress may increase the risk of infertility. हम लोग शादीशुदा होते हैं तो पहले 1-2 साल हम लोग सोचते ही नहीं है, क्योंकि we want to have a free life. I fully agree and I support you all together. But look at the reality. Get into a person who can guide you when to start your family. If you are delaying it too long, maybe that itself will contribute to too much stress on you. So, a 12-month prospective observational study of women starting to attempt pregnancy naturally is being tried out. हम लोग हमेशा लोगों को कहते हैं अगर सब कुछ सही है तो एटलीस्ट ट्राई आउट फॉर 1 year. As I said earlier, salivary alpha amylase, which is an index of stress, it gives us, and we have documented it earlier, that the more the stress, the more this enzyme is detected in the saliva. So infertility was more than twice as likely to occur in women with highest tertiary levels of alpha amylase. So अगर हम लोग कहते हैं कि मेरा पास स्ट्रेस नहीं है, but my salivary alpha amylase is high, that means you are trying to hide your stress, and again, that is causing more detrimental effect to the development of your things. So many questions are asked. Do you feel uncomfortable being around pregnant women? Do you find that you try to avoid situations where there are many pregnant women or babies or small children? Do you only make love during the fertile time of your cycle? ये तो हमेशा कहते हैं ना, सब लोग हमको आके कहते हैं सर हम लोग प्लान कर रहे हैं. तो मैं सबको यही सवाल पूछता हूँ, व्हाट डू यू मीन बाय प्लानिंग? You have to lead a conjugate life, enjoy your sexual health. So all these questions will be answered if you remain stress free. जब आप लोग हमारे पास आते हैं, how do we start assessing you? We start assessing you looking at your face, looking at your behavior, and looking at your emotional state of dealing with a physician. The main sources of stress for infertility patients include the impact of infertility on their social life, इन लॉज के साथ आपका रिलेशन कैसा होता है, सोसाइटी में किस माहौल पे आपको पार्टिसिपेट करना पड़ रहा है. दीज आर ऑल इंपॉर्टेंट. फर्दर their sexual health and their relationship with their partner is also affected. So the history taking, spending little time with the couple to judge their stress is a very important part of a clinician, because if we do that, explain them the reality, give them the right information, and as I told you earlier, 40% of those will become pregnant itself without taking not too many of medications at all. Most IVF patients report symptoms of depression, anxiety, anger, and isolation after unsuccessful treatment. And why does it happen? Because the proper information was not shared to them. They were of the impression that whenever they undergo IVF, हमको 100% सक्सेस मिल ही जाएगा. My co-colleague Pratibha last time shared with you what are the myths of IVF. I think knowing the reality is so important. Choosing a center is so important. Choosing your doctor is equally important, who shares you the right information and gives you the reality that should be taken together during the time of your treatment. So obviously, अगर जो लोग IVF कर रहे हैं अगर सोचते लगते हैं कि ना मुझे इतना खर्चा हो गया, मुझे तो 100% प्रेगनेंसी आना ही है, yes, that positivity is important. लेकिन इसके साथ साथ अगर इनका रिजल्ट नहीं आते हैं, इसका कोई मतलब नहीं है कि मुझे डिप्रेशन में जाना पड़ेगा, मुझे गुस्सा आ गया, मैं बहुत नाराज हूं. So we need to find out what are the causes, not putting on stress altogether. So how do you bring down, as I said, stress and infertility and stress हमेशा जुड़ा हुआ होता है, हमेशा हमेशा हमेशा. So we need to bring them down. I said there are 3 ways to bring them down. Practice breathing exercises जो हम लोग मेडिटेशन में करते हैं, योगा अगर हम लोग रेगुलर फॉलो करते हैं, our health will always be considered perfect. Find a creative activity जो आपके दिमाग को खुला छोड़ता है. Try to create something, be it painting, be it writing, or be it something new. Focus only on the present. Get focused about yourself. Then you will find your way out. Take care of your sleeping routine. If we start thinking हम लोग कम सो के मेरा काम कंप्लीट करके ही हम लोग आगे बढ़ेंगे, I think that's wrong. On an average, 7 hours of sleep makes you healthy and helps also in achieving your target on time. लेकिन आज के जिंदगी में कितने सारे लोग मिलेंगे जो 4-5 घंटा सोते हैं. We are glued down to the computer, we are glued down to our smartphones in search of knowledge or in search of something I don't know. Recently जब Facebook लास्ट वीक में थोड़ी समय के लिए बैठ गया, there was such a big huge loss. इतना ह्यू एंड क्राई हो गया. इंस्टाग्राम में ये हो गया वो हो गया. So that is how we see the world today. Social media is also indirectly contributing to the stress of every day. Always ask for help. इसमें कोई शर्मिंदा नहीं होना चाहिए कि मुझे थोड़ी सी प्रॉब्लम है, मैं आपकी थोड़ी सी मदद चाह रहा हूँ. What is the harm in sharing for help, asking for help from the person who in turn can help you at the right time? You must be active. Exercise करना बहुत जरूरी है. If you are not performing well, take a break. Go for a relaxation, 2 day break or even a 1 day break. I think that will give you enough energy to put you back on the mainstream. And finally, drink sufficient amount of water. मैं हमेशा लोगों को यही कहता हूं कि हमारा बदन पे 70% पानी रहते हैं. एंड कोई भी आदमी इतने ज्यादा पानी या लिक्विड पीते नहीं है. अगर हम लोग पीना शुरू करेंगे, हमारा बॉडी हमेशा हार्मोनाइज रहेगा एंड वी विल रियली बी परफेक्ट इन ऑलमोस्ट एवरीथिंग. अगर नहीं होगा तो एवरी सिंपल इफेक्ट जो हम लोगों को दुखी करता है, we'll try to react to that, and that reaction will ultimately contribute something not healthy. So how do you manage stress? Music, spa, exercise, change your hobbies, meditation, yoga, reach out to the nature and try to manage your time. क्योंकि आज के दिन में अगर टाइम मैनेज कर नहीं पाएंगे, that is the biggest stress every professional really faces. Remember, stress affects every organ in the body. It's not only the fertility. जिसके पास स्ट्रेस ज्यादा है उनके पास गैस्ट्राइटिस की प्रॉब्लम है, हार्ट की प्रॉब्लम है, ब्लड प्रेशर की प्रॉब्लम है, एंड एवरीथिंग इन द बॉडी इज अफेक्टेड बाय स्ट्रेस. Please share your emotions to the partner because they are equally important. They can help you and guide you. And if you cannot speak to your partner, if you cannot speak to your professional colleague to whom you can really and should express really, otherwise, ये stress बढ़ते ही जाएगा and your fertility problems will always be on the rise. Thank you so much. I'm not going to take you long, but effects of fertility on stress is very important. Your eggs are not going to be matured perfectly. Your hormone levels is going to be altered, and that's how your fertility will get lowered. So do everything to lower the stress. We have a very few minutes left. Let me leave it here today, and thank you for being in our program. So whatever questions you have in next 5 minutes, I'm here to answer for them. Thank you once again.
Hello, doctor. So there are a few questions that have come in. One is that, like you said, drink a lot of water. So this person has said that I watched another video which said drinking too much water will lead to bloating. How much water would you suggest a person to drink in a day?
Yes, that is also perfectly correct. In a woman, depending on the menstrual cycle, the hormones in the body changes. If you are close to your periodal time, you should cut down to slight extent on the water. But once your period have started, you should drink sufficient water. And what do you mean by sufficient? As I said, if your weight is 60 kilogram, you must drink at least 4 liters every day. But if you're close down to your periods, bring it down to 3 liters, because if you drink too many, obviously the bloating experience will become little more worse because the hormone progesterone comes in, and that is the sole hormone responsible for contributing to bloating.
Right, doctor. Thank you so much. And the next question says that, like you said, sometimes the right information is not given out to the patients. So, what factors should a person know from beforehand before getting into an IVF or fertility treatment?
I think getting the right information is always the key, and it is the onus of the persons concerned, maybe the couple or maybe the pre-pregnancy counseling session, who should be giving the right information, because the concept of pre-pregnancy counseling should grow in amidst our society. Normally, बच्चा जब होते हैं या हम लोग जब चाहते हैं तभी हम लोग आते हैं डॉक्टर के पास। लेकिन मेरा कहने का मतलब है, इफ वी आर मैरिड, we need to think that we have to consult the doctor for whatever is our aim, so that your clinician should be able to guide you and suggest you what is best for you. This is being a cafeteria choice. There is no shoes that fits all sizes. So depending upon the requirement of the couple, a clinician will suggest you and he will also guide you, giving you the right information.
Thank you, doctor. The next question is, what should one keep in mind? What factors should one keep in mind before choosing a right fertility center for themselves?
Right fertility.
Center.
Okay. See, right fertility center, which one to choose? I think I'm not going to dwell it on length because my colleague is going to speak on that within this month. Please be tuned to the information, because if I start speaking on that, I'll hamper into the domain of the preparation of my colleague. Pratibha will speak on this, and I think this is a very important topic for every couple, how to choose a right infertility clinic. So please hang on, let it remain a suspense. I'm sure within this month of October, my colleague will bring into you this information, and please hold on your nerve till that point of time.
Thank you so much, doctor, for that. Does stress affect infertility? Like, it plays a major role among the younger age people or the older age people?
Basically, it affects the older aged people, because young people are not so much stressed out because they diversify their actions in different disciplines. Yes, if they are really preparing or planning for a pregnancy and they're not achieving pregnancy on time, in those scenarios, even the young ones are also likely to get stressed up. But mostly, the fertility and stress is a topic which we consider more important for those who have crossed 32, because by that point of time, the spontaneous conception rate really dips, and our role is to pass on the information to counter the stress, giving them the information for next 3 years what they have to do, because as age advances, the complication starts pouring in, and the information should be really genuine and honest, that should be optimized for every couple.
Right. Definitely, doctor. There's another question which asks that, like you said, that based on the saliva and everything, stress can be checked based on certain criteria. Is it checked before a person is undergoing a fertility treatment or an IVF of that sort?
Obviously, we do not check it on a routine basis because it cuts on the expenses of the couple. But whenever we try to counsel them, we explain to them the stress factor in not achieving pregnancy. And if they hesitate to accept this as a factor, obviously we need to bring this documentary evidence to prove that they are stressed out, because today seeing is believing remains a dictum for whatever we do. So for our patients who always deny that I am not stressful, doc, please don't blame me like that. But if you are not finding anything other than the stress being the contributing factor, then we bring in this testing on not on a routine basis.
Okay. There is a question that says that if I have been into abortion previously, do I have more chances of gaining infertility?
See, if you have two consecutive abortions, you already are being clustered to a different heading altogether, what we call it recurrent pregnancy loss. So, a couple who has two consecutive losses are already being counseled and investigated in a totally different way, because mentally they are so disorganized and they are so low in their strength. It is we who have to bring in the investigations, counsel them in the best possible way with the best possible atmosphere. to give them the assurance that the black area in a third pregnancy, we bring it down with all requisite investigations so that there are optimum chance of having a baby in your next pregnancy. So our role in licensing them, getting them the confidence back into their system is more important. But obviously, they need to undergo a totally separate set of investigations for this.
Right, doctor. The next question says that apart from stress, do other mental health issues like anxiety or depression also affect fertility?
See, what exactly is stress is not clearly defined, as I told you. If you're talking about anxiety, yes, that is a part of the stress itself. If you tell me what constitutes stress, is not known to many of us. If you are an anxious personality, see, personality changes from one to the another, and depending on the situational, you have anxiety. Depending upon the environment, you have the anxiety. Depending upon the sharing of knowledge, you have anxiety. So, anxiety, on other hand, is a very important part of stress. So, what we really mean is, if we are not a normal human being, if we react to everything that happens around us in an abnormal way, our body will produce hormones. They are not really conducive to support fertility. So, to bring back the atmosphere to the optimum level, the best way is to understand what is giving you stress. At the same time, bringing in yogas and different meditation and different exercise protocols so that your body starts producing and countering the ill effects and help you in attaining your desire.
Thank you, doctor. Moving on to the last question, we have what kind of support should one expect from the doctor during a fertility process?
This is a very important question, I must say, because a doctor is one person for the couple whom they consider as their ultimate reach out person. Reach out in a sense because that person is going to give them the proper information, they will guide them the right way forward and be with them until and unless they attain their final desire. So, my take on this particular question is we should be humble enough, patient enough, and prepare ourselves adequately to give them sufficient time. And I myself practice it regularly, and many of my patients have given me a result without not being taking up too deep investigations, because once you create an atmosphere of happiness in the couple, the fertility process automatically sets in and the results are already being served. So we play a really immense role. We have to be within them every time, right from the morning till evening, because that's how they will gain confidence.
Right.
Thank you. Thank you for this question.
Thank you so much, Doctor, for telling people about the importance of stress and how it affects them both mentally and in terms of their entire body. So I think people learned a lot today about the interconnection and and how stress and fertility are related. So we thank you very much for taking out time to explain it to our audience. Uh, we hope Dr. Pratibha in her coming session sorts out the question of the fertility center for the audience. Till then, thank you very much, Doctor.
Yeah, yeah.
Thank you
I
all
just,
for joining us.
yeah, pretty. I just like to add on one last line for those viewers who are tuning in. For pregnancy, we need a healthy sperm and a healthy ovum, and the stress affected in both the parts in contributing a healthy ovum and in contributing a healthy sperm. So, lower your stress and bring down your sperm and ovum to the optimum level for easy fertilization. Thank you again. Thank you so much. Do tune in, do enhance your knowledge, and in an opportunity whenever you get it. Thank you so much.
Great. Thank you so much, Doctor. Thank you all. See you in our next session for tomorrow.